I'm declaring a public health and civil preparedness emergency.
I don't know how long it's going to last or when we'll all be back at work. I just don't know.
We know we may need to cancel classes for the remainder of the year.
I have never seen a bigger mess.
We're now, I think, at 16 plus days of that continuing 3-day downward trend. And you know that was an important criterion for our reopening.
It is looking good to be able to bring students back.
I think the restaurants are doing a great job. Everyone's following the guidelines, and, you know, it's good to feel safe.
That's not unexpected, but it still wakes you up like a cold shower.
The next 6 weeks are going to be the darkest weeks in modern American medical history.
There is light at the end of the tunnel.
This is the weapon that is going to win the war.
And it's important to communicate to the American people it's safe.
It could be ball games, giving your significant other a hug. In my case, my wife, my kids, my mom.
Worked very hard to get it to you. Now's the time to take it to keep yourself safe.
Live from the News 8 studio, this is Connecticut's Shot in the Arm.
Hi, everybody. We're glad you're with us tonight. I'm Darren Kramer.
I'm Lisa Carberg. Welcome to Connecticut's Shot in the Arm, our virtual town hall special about the COVID-19 vaccines.
Distributing these vaccines is going to be historic and a monumental task, and so is convincing people to take it, too. We know you have so many questions and concerns about these shots, and we want to answer those questions for you tonight.
And that's why we brought together the power players getting the vaccine to the people of Connecticut. Joining us tonight is Governor Ned Lamont and the co-chairs of his vaccine advisory group, Dr. Reginald Eady and Dr. Deirdre Gifford. Also here, Onyema Abuagu. He was Yale's lead investigator in the Pfizer vaccination trials.
Also with us tonight, Michelle Siegel, Commissioner of the Department of Consumer Protection, Keith Grant, Senior System Director for Infection Prevention at Hartford Healthcare, Brittany Orlando, the clinical lead for Stop and Shop Pharmacy, and State Rep Brandon McGee, who serves Hartford and Windsor. Thank you all for being with us tonight.
All right, before we get to your questions, let's talk a little bit about how the Pfizer and Moderna vaccines work.
Yeah, they both attack the virus the same way with a brand new method, but there are some differences. These are the first of the magic bullets being rushed around the world in the hopes of finally getting the upper hand on this global pandemic. The first vaccines being given in Europe this week, the first two in line from Pfizer and Moderna, attack COVID-19 in basically the same way. They both use a new technology called messenger RNA. It's man-made, not a little bit of the real virus like some other vaccines work. In simplest terms, the mRNA teaches your body to make antibodies that make you immune to COVID-19. Both are very effective. In trials, the Pfizer shots worked about 95% of the time, Moderna 94%, both considered remarkably good. Keep in mind the flu shot is only about 45% effective this year. Both the Pfizer and Moderna vaccines require 2 shots in the arm, 21 days apart for Pfizer, 28 days for Moderna. Some people do have side effects, but they are minor. Things like muscle pain where you get the shot, chills, and sometimes headaches. The biggest difference, the Pfizer vaccine has to be stored at super cold temperatures, about 94 below zero. That means it has to be kept in special medical freezers, but Pfizer says it has come up with a dry ice storage system that they say will keep the vaccine viable for weeks without special equipment. The Moderna vaccine can be kept in a regular refrigerator or freezer, making transport cheaper and easier. And just on Tuesday, data released from trials of AstraZeneca's vaccine suggests it is safe and about 70% effective. It's unclear if or when that vaccine will get approval here in the United States. Pfizer could get emergency approval as soon as tomorrow when it goes before the FDA. Canada has just approved it as well. Moderna is scheduled to seek approval next Wednesday on the 17th.
All right, so let's get to the discussion. Governor Ned Lamont, you probably saw this brand new national poll from Quinnipiac asking if a COVID-19 vaccine is approved by government health officials, do you think you would be willing to get vaccinated? 61% of people responded yes, but a third of them answered no. Why is it so important for everyone to buy into this?
Well, Lisa and Darren and everybody, first of all, I really appreciate you doing this show. You're doing this show now, educating people about the vaccine and how important it is. As you point out, we're going to get our first shipment in less than a week. And the vaccine is only a shot in the arm for your health, and a shot in the arm for our economic health, and a shot in the arm for our morale in the state if people actually get the shot in the arm. And as you point out, there's still some what they call vaccine hesitancy out there. I'm really glad you got Deirdre and Reg on here. They're leading our vaccine advisory group. It's made up of scientific professionals, but it's also made up of political leaders, labor leaders, religious leaders, to get into the community, to give people confidence. Take the vaccine. You can take it safely. It's good for you and your community and your family.
Governor, this is a huge logistical problem, getting this vaccine out to people of our state. Is Connecticut ready to do this? And this stuff could be coming to us in days, if not hours.
I think we're ready. We've got the best team working on this. You're right, though. It is a logistical load to carry. Some have to be at one temperature, others in another temperature. Some are every 3 weeks, some after 4 weeks. You've got to figure out who's going to get it and how you prioritize that. But our vaccine advisory board is ready to do it. We got some great partners, starting with the pharmacies, including Walgreens and CVS and our local pharmacies. They're going to be drop ship of the vaccine in dry ice. I think our team is ready to go. Are you?
All right, we have questions from our viewers now that we will be playing throughout the night. We thank everybody for submitting them. Here's the first one.
All right, let's take a look.
Good evening. My name is Becky Smith, and I'm from Brantford. My question tonight is, will this vaccine be similar to that of the flu shot, where you have to get it annually, or will it be more like historical vaccinations, where you get it once and you're good for an extended period of time, if not forever?
All right, thanks, Becky, for that question. Let's go to Dr. Abuagu from Yale to answer that first question.
Yeah, thanks, Lisa and Darren, for having me as well. Great question. We don't really have all the answers to that at this time. I think it's dependent on two things. One would be how long the vaccine-generated immunity would last. So if that lasts for a long period of time, then it doesn't really depend on the seasonality of the virus. But we just don't have that data yet. Also, we don't know if the virus would end up becoming a seasonal virus or the epidemic will fade away over time. What I do know is that based on the data we currently have is that the vaccine immunity lasts at least as long as 2 months with levels above target range for antibodies. And the studies are ongoing to see the durability of that response. We just have to see what happens with time and if the virus fizzles out with this current wave or ends up being seasonal.
Doctor, thank you. We're going to let you put your earbud back in there. We'll continue on now. We have another question. Thank you for that answer. Our next question tonight from another viewer, and this is the question. Each year, when I get a flu shot, I am told it will not be completely effective for 2 weeks. When the first shot is administered, how long before it's effective? Dr. Gifford, let's ask you that one.
Well, as the governor and you mentioned, the recommendation for both of these vaccines is 2 doses. So it's very important that we all keep our masks on and we keep our social distancing and mitigation strategies going after the first dose. And as Dr. O mentioned, we're still learning about the duration of the immunity after this vaccine. It looks as if, and I would invite my infectious disease colleagues to chime in as well. It looks as if it's similar, that within a period of a couple weeks after the second dose, the full immunity. Yeah.
All right, let's go to Maureen in West Hartford. She has this question about efficacy.
Is it going to be effective? How's it going to affect the population? One of my biggest concerns, I was just talking to my grandson about, is this second wave, the same virus as the first wave, or is it mutated?
Again, a lot of concern about how long immunity will last. Dr. Edie.
It will certainly be effective. I mean, as you guys indicated at the top of the hour, AstraZeneca is anywhere between 70 and 90% effective. Moderna, 94%, and of course the Pfizer is 95%. So the goal here is to develop herd immunity. And remember, viruses do mutate. So scientists like our colleagues participating on this panel will be watching closely at the virus and adjusting accordingly in terms of the guidance they will provide to all of us.
All right. Another question from one of our viewers. This is from Barbara in Monroe. She asked tonight, will the vaccine keep you from spreading COVID to non-vaccinated people? And how would we know whether it did or not? Keith Grant, let's ask you that question.
So that's actually a very good question, a question that we've gotten a number of times over the last 24 hours. So one of the things that we do know, and as we've spoken about before, the efficacy of the actual vaccine itself. So if you look at what the efficacy actually means and how the virus is spread, it prevents you from carrying a certain viral load and it allows you to build antibodies. And if you look at just the pure science around that, if it reduces the amount of people within a community that has the virus, then yes, it definitely should contribute to preventing you from actually spreading the virus as well.
Interesting. Okay, Jody has this question. What if you have COVID and don't know it and get the vaccine? We've had several viewers ask about if you need to get a negative COVID test before getting vaccinated. Dr. Gifford, weigh in on that, please.
No, I don't think there's going to be any recommendation for individuals to be pre-screened prior to getting the vaccination. There were, in the trials, there were individuals who had antibodies to COVID, indicating they had a prior infection. So they did receive the vaccine, and my understanding is there was no difference in the adverse, the reactions based on whether they did or did not have antibodies to COVID.
All right, this question comes in from a man in East Haven who says he feels like the government is pressuring him and pressuring the public to get this vaccine.
Hi, I'm Andrew from East Haven. If a person chooses not to get the vaccine, will the government create backdoor punishments to try to pressure people into getting it, such as refusing passport renewals, license renewals, or some kind of financial penalty?
All right, Governor Lamont, this one's for you. Can the government punish folks who don't want to get this shot right away?
No, no intention of that at all. We're trying to encourage everybody to get the shot. Connecticut is more lucky people voluntarily to get the flu shot. I think you're going to find Connecticut people do the right thing and get the vaccination as well. But we're not going to have to force anybody's hands. In fact, demand will outstrip supply for the first 2 or 3 months. That's why we're working hard to encourage you to get vaccinated.
All right, Governor, thank you. The research that made this Pfizer vaccine possible happened in our own backyard.
Well, people here in Connecticut rolling up their sleeves in the hopes of putting the pandemic behind us. Coming up, I'll introduce you to 2 participants and share their stories as to why they volunteered to take part.
By using this vaccine, we build a wall around ourselves, our families, our communities.
Plus, the Hartford healthcare doctor making his case for getting the vaccine. And we're answering more of your questions. It's all next. Stay with us.
In the lab at Clinical Research Consulting in Milford, where already 237 people have participated in Pfizer's COVID vaccine trial. You're about to meet 2 people who've offered their services to science.
COVID vaccine trial participants from here in Connecticut are sharing their experiences less than 4 months after their first injections. Both Diane Hessinger and Anthony Lupinacci have agreed to be part of Pfizer's clinical COVID vaccine trial for the next 2 years.
I wanted to participate from the very beginning.
Diane, a former Pfizer employee, shares why she volunteered her services to science.
I have an 89-year-old father and an 85-year-old mother who's in a nursing home. It's to bring a treatment to everybody, not just to benefit myself.
Anthony Lupinacci is the director of marketing and community relations at the Schubert Theater. He pored over clinical research for months, reading articles about how the vaccine was being produced and how our bodies would use it. He says the only thing to fear is the virus itself.
I was just in such disbelief that all these people were dying in the country. And more scary, that a lot of people were being led to believe that this really wasn't even true.
Pfizer's vaccine is a two-part series. Each individual must record how they're feeling daily in a verified mobile app. Anthony had 0 symptoms, while Diane developed a reaction around the injection site and had a headache for 3 to 4 days after the shot was administered.
Do I hope that means I got the vaccine? Absolutely. Do I know for certain? No.
Both trial participants are trying to break the stigma that the COVID vaccine from either Pfizer or Moderna are dangerous.
I think people are generally scared right now because things seem to move fast. But having come from that arena, safety is always first. I'm more scared of the virus than of the vaccine.
Now anyone 18 to 85 years old can participate in this latest trial. Darren, Lisa, back to you.
All right, Amber, thanks. Some new developments overnight, too, with the Pfizer vaccine. UK health authorities issuing an urgent warning. People with a significant history of allergic reactions should not be given the vaccine. That's new. This after 2 healthcare workers experienced symptoms after receiving a shot. Dr. Abuagu, any insight on this? Should the U.S. make this same recommendation? Where are you on this?
Great question. Frankly, we in the clinical trial protocol, we did not include people who had severe history of allergy or anaphylaxis to vaccines. That's not to say that those individuals should not receive vaccines in the future, but definitely is something that if an individual has a strong history of that, to probably be cautious around that. We do have medications we can pre-administer to people who have history of allergy so they can tolerate the vaccines, but certainly the warning is appropriate.
All right, thank you, Dr. Abuagu. This question now submitted to us through our Report It app about the possible side effects and how to treat them. She asks, my husband is in his 80s and I'm in my 70s. We both have underlying medical conditions. Will this be safe for us? And if we get a reaction, will it be able to be treated like a home remedy like Tylenol, or will we end up in the hospital? Keith Grant.
Yeah, so again, very, very good question and very good concern. So based on the safety profile that we've seen so far in this vaccine, it will be, there's no reason to believe that the reaction should be severe. And the treatment, as most other vaccines, should be able to manage from home.
All right, thank you, Keith. Here's a question now from Jennifer. She has type 1 diabetes. Let's listen.
Hi, my name is Jennifer Shea from Wallingford. My question is how will the different vaccines work with people with compromised immune systems or immune systems that are immunocompromised? With that being said, which vaccine would be better for people who have immune system issues already? I've heard that the vaccines can speed up the immune system to build antibodies, but what will that do to people who already have compromised immune systems? Can this set off attacks on other organs?
All right, Dr. Edie, a lot of people reached out with that concern. Do you have an answer for Jennifer?
So I guess my first response would be that, she described the ideal candidate for such a vaccine. I mean, these are the people that we want to protect, those who have chronic diseases. If I remember correctly, about 8.4% at least of the participants in the Pfizer study actually were diabetic. But I think the right answer to give to her and the listening audience would be that we're still waiting for the ACIP to come out with final recommendations as to who to include.
Yeah.
We have also received a whole bunch of questions from our viewers about if the vaccine is safe for people who are on certain medications. Listen.
Hi, my name is Sandy. I live in Woodbury, Connecticut, and I'd like to know if there are any vaccine guidelines for people who are taking immune system suppressants.
Okay, is it safe to take this vaccine if you are taking those? Dr. Gifford.
So I'm gonna defer the answer to that question to my ID colleagues on the call, but I do want to say that in general, the participants in these trials were well represented. Many of the underlying chronic conditions that we're concerned about, as Dr. Eady mentioned. And as Dr. Grant said, that the majority of the side effects, they were fairly common, but they were also, in most cases, mild. So I think individuals who have complex conditions, multiple chronic conditions that are taking medications will obviously want to talk to their healthcare provider and get specific advice about taking the vaccine. But to that particular question, I think I'll turn to Dr. O and see what he would advise.
Dr. O, let's hear from you on that.
Great. Yeah, so we definitely do recognize that immune-compromised patients are definitely a target population for vaccines, given that they have disproportionately worse outcomes. However, the category of immune-compromised patients is kind of varied. For example, you have individuals with HIV infection. The trial included people who were on treatment, virologically suppressed and with good immune systems. Patients who were getting cancer chemotherapy were excluded. So certain immune-compromised patients, for example, like diabetes, like Dr. Eady correctly mentioned, were represented in the study, and we did not find any differences with vaccine efficacy based on those underlying conditions. So I think the committee will be looking very closely about who was included or excluded from the study and make determinations on the breadth of candidates for when it receives the EUA.
Doctor, thank you. Our next viewer question, this one affects a lot of people too. The question is, has the vaccine been tested in obese individuals? Are there concerns about the effectiveness of the vaccines in obese individuals? Dr. Eady, let's hear from you.
Yeah, so you're right. This will impact a lot of people, yours included. So as we struggle through this pandemic with weight gain, but nonetheless, at least 35% of the participants in the Pfizer study were actually obese. So I think those of us that suffer from that disease, we're in a very good place when it comes to this vaccine and the safety around it, us taking it.
All right, thank you for that. So even with the safety results of the vaccine trials, we see some hesitant to get vaccinated. Listen to Hartford healthcare pulmonologist Dr. Patrick Troy on why everyone should feel safe getting vaccinated as soon as they can.
It could be ball games, giving your significant other a hug. In my case, my wife, my kids, my mom, getting back together with families, barbecues, travel, all the things that we hold and cherish as the quality of our life.
Dr. Patrick Troy on how people's lives could change in 2021 if they get the COVID-19 vaccine.
I'm incredibly enthusiastic about the difference that they could make in terms of giving real hope for the first time.
He says we could eliminate the coronavirus in months if we get vaccinated. Dr. Troy says this vaccine is nothing like any others developed before for different conditions.
Older vaccines use part of the virus or a weakened version of the virus or a protein that's in the virus. That's very laborious to make. It's hard to do. It takes a long time. That's not the case here.
As for the level of protection offered by the new vaccines?
In some of these trials, the levels of antibodies that we're seeing in folks who get vaccinated are some 10 to 15 times higher than people who actually had COVID.
Peace of mind, he says.
By using this vaccine, we build a wall around ourselves, our families, our communities.
He says the vaccine is our gateway to getting back to normal.
We can get a real sort of head of steam behind that process by using this vaccine and really move it along. The more people who get vaccinated, the faster we move.
All right, I want to go to Keith Grant now. Keith, you heard your colleague, Dr. Troy, make his case for getting the vaccine. It's really important to get everyone on board in order to achieve herd immunity. How many people have to buy in for this to work? And are you worried we won't get there?
Am I worried we won't get there? Let's deal with that question first. I think if you ask that question to everyone on the panel, we'll say we have a lot of faith in our colleagues, a lot of faith in the citizens of Connecticut. We have a lot of faith in or ability to pass on the appropriate information to help people to be more comfortable with taking this vaccine. I do believe that within the next few months, we'll have a huge task with distribution, the logistic of distribution, the logistic of administration. But I think the most important task we'll have is going to be passing the right information on to our citizens. And we will get there. I genuinely believe we'll get to the point that we will appreciate the herd immunity that this vaccine will have to offer.
Doctor, thank you. You know, healthcare workers on the front line of this epidemic are going to be the first to roll up their sleeves. Their vaccinations could start as early as Friday. Dr. Edie, during the news conference the governor had recently, you said that Trinity Health surveyed its workers and found that about 60% said they were willing to get the vaccine. I'm not a doctor. That seems shockingly low to me for people who work in the medical field. Are you surprised by that number? Do you want it to be higher, and how do you change that number?
Yeah, so first of all, I think it's good news that 60% of the men and women at Trinity Health of New England have agreed in advance without a lot of information. And this study or survey is a couple weeks old. And I think it speaks to the commitment that they have to safety, not only amongst themselves, but also to the people that they serve. Yes, we do want that number higher because the higher, the safer. Again, for not only the colleagues, but also for the communities that we serve. And so the research told us a little more about what we can do to increase that number. It suggested that we can provide additional explanation, elucidation, or information around the efficacy, the quality, and the safety of the vaccine. They were interested to learn more about the speed at which this vaccine was produced, why, and if that's safe. They also teased us with information such as how the mRNA new technology actually works. So we have the obligation to respond accordingly. It was interesting to see when we asked how often they wanted this information, their response was that they wanted it on a weekly basis. The majority of the people that responded to, as expected, responded to the survey were nurses. And interestingly, about 68% of the respondents were less than or equal to 54 years old. So this is very consistent with what we're seeing in other local surveys and across the country. And I had no doubt, as Dr. Grant suggested, that we're going to get to the level that the governor expects us to get as quickly as possible. And the rate limiting factor, of course, is going to be the availability of the vaccine.
May I interject here? Just provide information. You know, by now we all know that COVID-19 is not an equal opportunity killer, right? Black, Latino, or Latinx and indigenous people, they're getting the disease more often and suffering more severe outcomes than our white counterparts. We also know, and I'm learning a lot, an awful lot with all of these smart minds on this issue, but we know that there are trust issues between Black and brown people and government and health systems. So I'm honored that we're having this very open dialogue, but this pandemic has hit us really hard, both in terms of health and economically. We need to figure out what our immediate responses might be to mitigate, and long-term address structural racism, so we won't put communities of color, back in this position of bearing the brunt of public health issues. So I think if we begin to go on that educational journey of informing the hardest to get to communities, I'm almost 100% sure that many of these folks would buy into these new vaccinations. But I just wanted to bring that to the center of this conversation as well.
Great point, Representative McGee. Thank you very much for that. All right, next, we are tackling distribution. How do we get the shot in the arm to the people who need it most first? And then what about the rest of us?
We'll be back here in just a minute.
Do you think there'll be problems getting the vaccine? Are you worried about the second shot? You have to get 2 shots?
No, I'm not.
What's that?
No, I'm not worried about getting the vaccine. I think it'll come. When it's my turn will come.
Do you know where to get the vaccine?
I do not.
Do you know how it's being distributed or how you could get it if you wanted it?
No.
You worried about how it's going to be distributed, or have you heard about it?
No, I haven't heard about it. My doctor's office, maybe. I really don't know.
Welcome back to Connecticut. Shot in the arm. We're taking a closer look now at the distribution plan outlined by the state of Connecticut.
So many questions folks have. So here's the deal. There are 3 tiers now. Phase 1A could begin as soon as next week if Pfizer does get that emergency approval. Falling under the first category, healthcare workers, nursing home residents, and medical first responders. Phase 1B, which is expected to start in mid-January and last several months, in that category includes critical workforce, other congregate settings, adults 65 and over, and high risk under 65. Phase 2, the final phase, anticipated for early June, that will include children under the age of 18 and remaining adults over the age of 18. Part of the distribution process is to make the vaccine more accessible than ever.
That's right, and all of these businesses have already signed on to administer the vaccines. Stop and Shop, Big Y, CVS, Walgreens, and Rite Aid all signed up.
Yeah, people have a lot of questions about how the vaccine will be given out.
And Stephanie is asking this. I'm wondering how things will work with vaccinating the individuals in the specific groups. Distribution sites won't be able to handle people just showing up. Will individuals be assigned dates and times according to their need?
And Brittany Orlando, the clinical lead for Stop and Shop Pharmacy, is with us tonight. Brittany, how's this going to work? Will it be appointment based? Is there an app? What are you folks planning for this?
I think that's a fantastic question, and that's something we've been working on over the past few months, is preparing for how do we get folks immunized and how do we do it in a safe way that still observes social distancing, allows for time to disinfect the area between each immunization and factors like that. So we're absolutely looking at an appointment-based model, as well as looking to host some organized community events. That way folks know where to show up when it's their time, you know, if they belong to the specific group that the state or Department of Health has determined is the next one in that phase to get protected. We'll do our part to keep that organized and make sure everything goes smoothly.
All right, Brittany Orlando with Stop and Shop Pharmacies. Thank you. There are roughly 600,000 seniors living in Connecticut. Most fall into that second phase. Here's a question from a viewer. My wife is 74 and I am 78. How will we know when the vaccine is available for us older people not in nursing homes? And Frank from Simsbury asks, how are seniors going to be prioritized for vaccination purposes? Who gets shots first? Is it first come, first served? All right, Michelle Siegel, Commissioner of the Department of Consumer Protection. Can you answer that for us?
Yeah, it sounds like there were a couple of questions. So first, in terms of how you're going to know when it's available, the governor put together, as we've talked about, this advisory group. And within that, there are actually subcommittees, one dealing with communication, another dealing with allocation. So those are two really important and complicated questions. There's a whole bunch of really smart people, some of whom are on this panel with me, who are working on those. But for people who just want to know the latest information, there's a great website, ct.gov/coronavirus. That's a great place to go. It's constantly being updated, has a wealth of information, so you can always look there. But communications group is working incredibly hard to put out an aggressive campaign on social media, traditional media, publications, using trusted members of communities. So you should be hearing about it in a variety of ways. In terms of how people within these subgroups are being prioritized, that also is a tricky one, and there is a subgroup working on that. At this point, the group has been focused on the first tier of vaccinations and how to prioritize that. But the way the process works, there is recommendations coming down through the CDC from the federal level, and these subgroups are then looking at those recommendations, seeing how they fit with the situation on the ground in Connecticut, deciding if there should be any slight tweaks to that, and then making a recommendation up through the advisory group to the governor on doing that. So hasn't been formalized yet as to how that group 1B will be kind of split up, but that is being worked on very aggressively as we speak.
Okay, we'll be on that every day here at WTNH. We'll also have the link to that website on our website, WTNH.com, in the News 8 app. All right, now a question from Eric. He says, I have a 101-year-old mother that is homebound. I had a very hard time just to get her a flu shot at home. Will there be anything in place to take care of homebound people? Home vaccinations or rides to and from vaccination locations? She would need special transportation. I'm sure I'm not alone with this problem. Dr. Gifford.
Yes, that's a really excellent question. And as my fellow Commissioner Siegel was mentioning, we are in the process now. We're waiting for the recommendations from the CDC that will be meeting on Friday and Sunday, and then in the process now of further spelling out for the public in Connecticut how that next phase of vaccinations will roll out. We certainly understand that there are individuals that will need special considerations. If this is an individual who's receiving services in her home, she may be able to receive her vaccine through that service provider. And if not, working through her healthcare provider, will be able to accommodate either transportation or some way to facilitate the vaccine for individuals who are unable to leave their home. But I just want to build on Commissioner Siegel's comments that this is a quickly evolving situation in terms of the prioritization that will be coming down the pike for the next group. And together with my colleagues on the Vaccine Advisory Group, we will be making recommendations to the governor about the membership and the priorities in that next group, and then sharing them with the public promptly as soon as those recommendations are finalized. So more to come in the days and weeks ahead.
Okay, this question kind of goes along with that too. This question is from Jennifer. She wants to know if teachers and school staff will be put into the frontline workers phase, and when will they be able to get the vaccine? She says the governor's state schools need to be open, but I have not heard us talked about when getting the vaccine. Dr. Edie, teachers are not in this first phase right now. Why not?
Yeah, so because when the ACIP decided who will be participating in phase 1A, they were concentrating on those that are in high-risk environments that are taking care of, hence the healthcare workers, those who have been diagnosed with COVID. But, rest assured, teachers are going to be coming up very quickly. Again, rate limiting factor being the availability of the vaccine. And whatever the governor is asking us to do as an advisory group, we will ensure that the allocation committee is receiving messages every day that they take that to heart and they make the recommendations accordingly.
All right, thank you very much, Dr. Edie. Coming up, is there a COVID-19 vaccine that's been proven safe for kids?
And next year, we're going to go over the latest research and talk about whether the vaccine will be needed for the next school year.
And what's being done to get the vaccine to communities most at risk for COVID-19 complications. We'll be right back.
Concerns regarding the safety of the vaccines, only because it's fairly new. And as we know, a lot of times, a lot of the complications arise years after we've already taken it.
Well, you just heard from a young woman who is concerned about the safety of the vaccine. It's a common theme, especially in urban communities and among people of color, as we've heard tonight. According to recent research by Pew Research Center, just 42% of black adults say they would definitely or probably get the COVID-19 vaccine. That's compared to 63% of Hispanic, 61% of white, and 83% of Asian American adults. All right, Brandon McGee, you represent Hartford, and what are you hearing from your constituents about the vaccine? I know you've learned a lot tonight and you've been sharing your thoughts on this.
Yeah, it varies and it depends on the various stakeholders that, we've been reaching out to. And I really applaud Dr. Edie and his efforts. Had a conversation with several hundred faith leaders and other stakeholders to educate and provide awareness on this vaccine. But, one thing that's become really, really clear to me is that in addition to the governor's efforts, the government and health systems coordinating, right, should definitely include CBOs, which they have, community-based organizations that have, I call the real relationships with hard-to-reach communities. And, there's been a disconnect. I think we all might agree to that in the pandemic response. And a lot of the services and supports, they're not getting, again, to those hard to reach communities. And, I don't want to make blanket statements. The folks on this call, in addition to others on the advisory committee, have worked really, really hard, long hours to include all of the voices. But again, as I've said earlier, there's been a lot of mistrust in Black and Brown communities. I don't want to give you an educational history lesson, but we're all familiar with the Tuskegee experiment during, the 1930s, lasting until the 70s. Henrietta Lacks, the African-American woman who died of cancer, and they cloned her without her permission or her family's permission. So there's a lot of mistrust. But one thing is for sure, I do know with education and having some of our more prominent leaders who have trust by many of the stakeholders to be on some sort of a messaging campaign and awareness, it'll be vitally important to increasing those numbers of individuals and communities of color interested in, taking the test or the vaccination. And then lastly, when you begin talking about federal dollars, let's begin allocating some of those funds to local CBOs who, again, understand the culture, the messaging, et cetera. So we got a little ways to go, but I am very cautiously optimistic. And I am hoping that next week or the weeks after, we have a high number of communities of color participating in this vaccine.
Okay, thank you for that.
Can I just make a comment?
Sure, go ahead, Dr. Abuagu.
Okay, so again, just want to highlight some of the issues that Representative McGee mentioned, and again about the work that we need to do to make inroads to communities of color. And I just wanted to highlight a model that's worked for us at Yale. So the Yale Center for Clinical Investigation has a cultural ambassadors program, and this is more than a decade old. And we've long realized that if we're really going to engage communities of color, it's not when we have a new research project about to start. That we need to establish trust and longitudinal relationships, engage leaders in the community, for example, pastors of churches, engage community-based organizations that reach out to racial and ethnic minorities, and that's been a very, very fruitful model for us. Engaging these communities all through the process of research, from designing protocols to messaging about those protocols, to educating them about the value of research, including them in research trials, and also messaging about results. And so I think that that's definitely one model that I wanted to highlight as a way to successfully engage in communities of color in research, and also to reap the benefits of research, for example, the COVID vaccines.
All right, thank you. Dr. Eady, you've been doing a lot of research when it comes to educating people about the vaccine. Talk about what Trinity Health just announced today.
Yeah, so from the start, we have committed to the community that we will listen to, partner with, and make it easy for them. And this vaccine is sort of our first big test, if you will. And the representative and I have had multiple conversations. He's very good at holding us accountable. And we agree that education is the key. And so what we have done is we've carved out time out of our busy schedules to provide vaccine education to the community organizations as well as members of the community. And we do this on demand. So immediately after the request, we rearrange our schedule as we make ourselves available. The goal here is to arm leaders, and especially those where there's hesitancy in the community. So brown and black leaders in the state of Connecticut with the knowledge so that they can have the intel to make the right decision. And the right decision, we believe, is to get vaccinated. So this has been very successful. We're partnering with other healthcare systems as well. And then we also had the opportunity, I guess about 2 weeks ago, an organization called DHCA got about 18 African-American community leaders together. And so what we wanted to do is to start understanding how the what the impact the conversation or the education would have on their likelihood to take the vaccine. And so we asked that question at the top of the presentation. How likely are you to take the vaccine once it's available? 47%, as you see on the screen, said we'll take it immediately. 27% said not a chance, we're not going to do it, and 27% were unsure. About 45 minutes after presentation, another 15 to 20 minutes of Q&A, we repeated the test, and the results were astonishing. 64% then said, yes, we will take the vaccine. And so this is indicative of the trust that the community needs. They just want their concerns answered, their questions answered, and their concerns addressed. Only 7% said no, and 29% said they were unsure. So this is key, and this is what Dr. O and the representative were alluding to. As long as we listen to, partner with, and make it easy for them to understand, in this case, the vaccine, how it works, the efficacy, the quality, and the safety around it, which I'm proud to say under Commissioner Gifford's leadership, the advisory committee is doing just that. We see, and the data proves, that we can be effective and push our state toward herd immunity so that we can get back to some degree of normalcy.
Yeah, that Dr. Eady, that needle moved quickly. It sure did. The data on the efficacy and safety of these vaccines so far has been all about how it works in adults. But what about kids? News 8's Bob Wilson takes a closer look.
Moderna and Pfizer now testing on children with parents' permission at different age groups, hoping to have a vaccine by mid to late summer, just in time for fall of 2021.
Pfizer is starting in kids 12 and above, and now Moderna, I believe, is going to go down to 7.
The side effects in adults have been similar to those of the flu. So how does that translate to children given the vaccine for testing?
I would anticipate the kids might do better with the vaccine, have less side effects. They won't even know they got the second dose, because kids often don't show the same things that old people when they get immunized.
Doctors encourage parents to read the studies for themselves. The results for adults and children will be published on the FDA website when approved. Moderna is now looking to have a vaccine for the children.
I think the kids are very important. They should.
He doesn't feel like he should be. So, you know, we were just talking about that.
I don't know what I'm putting into my body, and it's just, we don't know too much about it.
The FDA will again say, okay, is this safe in children? Let's look at the 100,000 children they gave it to, or 50,000, make sure there's no problem. And my bet is later in the summer we'll have a vaccine for children, but I can't promise that.
And doctors at Connecticut Children's say, don't be surprised if you see 2 or 3 more vaccine companies coming forward in the next couple of months, as they need to have a lot of product out there, especially when it comes to children. We're in West Hartford. Bob Wilson, News 8.
All right, another question from Andrew in East Haven. Now, he wants to know about the vaccine in the next school year.
Will children be required to take it in order to attend school in the 21-22 school year? Children should not be punished by not being allowed to attend school because parents aren't comfortable giving them a rush vaccine.
Dr. Gifford, we're a little tight on time. What do you think of that?
Really haven't been any discussions about mandating vaccine, and there's no plan to do so in the coming year.
All right. Thank you. No mandate is what she said. A little audio problem there at the beginning. When we come back, our panel's final thoughts about the vaccine in a moment. Pardon. All right, we just have a few minutes left. We want to give our panel here a final opportunity to speak and make their case to the residents of Connecticut.
All right, let's start with Dr. Gifford.
Thank you. Thank you so much for hosting this really important conversation this evening. Thanks to my fellow members of the panel. I'd just like to say that this has been a really long and difficult 8 months for all of us in Connecticut and around the world, really, with this pandemic. And the opportunity that's before us with a potentially extremely effective and safe vaccine really is the light at the end of the tunnel. We're going to see big news tomorrow and in the coming days from federal agencies that are reviewing the data and will be sharing with the public their findings. So I encourage people to pay attention to what those agencies have to say. And then we at the state and with our community partners will be sharing that information, and we look forward to a successful vaccine campaign. Thank you very much.
Excellent. Dr. Edie.
Yeah, so I'll just say to the citizens in the state of Connecticut, the great state of Connecticut, look, the last 9 to 10 months have been very, very hard for us. We've lost friends, families, and loved ones. But now there's hope, there's sunshine that's presenting itself in the form of a vaccine. Listen, if we do nothing, we know and can forecast the outcomes. We've been experiencing them tremendously over the last few weeks and for the last 10 months. So the right thing to do is to get vaccinated. Let's do it.
We've got about a minute left in the show. Dr. Abuagu.
Okay, just want to say hi, Connecticut. The vaccine results are real. I really think this is the beginning of the end of the pandemic. And if you're asking yourself what you can do to contribute to ending this, get vaccinated.
Thank you. Keith Grant.
Hi, guys. Again, thank you so much for putting this together. We're going to do, as much as we can to pass the appropriate information on. Get informed, get vaccinated, and keep informed.
All right, Representative McGee, your final thoughts.
Thank you so much for this opportunity. I underline, support, echo all of my colleagues. Please get vaccinated. But guess what? We still need to ensure that everyone has access to information to make the best decision. And the trust issue is not going to go anywhere tomorrow, but let's know for sure, guys, it's important to be vaccinated.
All right.
So thanks.
We want to thank all the leaders for taking part. We hope you learned a lot tonight.
Yeah, sure did. And thanks to all our viewers for the great questions. Thank you for watching. We got more news coming up. News 8 at 8 on WCTX is next. We'll see you later tonight at 11 right here on News 8.